Dr. Boyd. My name is Jonah. I'm a first-year PT student, and I've actually been at UIC for about 7 years now. I went to undergrad here as well.
My name is Andrew Boyd. I'm a faculty member in the Department of Biomedical and Health Information Sciences. I've been using AI for research for the last decade or more on a number of different research grants.
As a student who uses AI to study, to help me with different case studies and to piece together the topics that my classes cover, I'm about to head out into clinical placement. And I want to know, where can I expect to find AI in my clinical placements?
Every health system is a little different. Every health system gets to decide what AI gets deployed at their hospital, at their clinic, at their inpatient rehab setting. And with their health information, they and their lawyers get to adjust the risk for using artificial intelligence or large language models. And so I would have you talk to the clinical instructor, the prime person at each individual site, about what AI is allowed at that site and what AI is not allowed, because one site will be different than another. And if you're rotating on Monday at one site and Tuesday at the other, it'll be a little bit hard to remember, but every site gets to decide.
I typically use ChatGPT on my own when I'm studying, but is there any other models that are really popular that I'll encounter?
Most of the models that you will encounter will be owned and managed by the health system. So I would not encourage you to use your own personal ChatGPT or any other co-pilot to use. If you are writing a case study or if you're using information, don't take a health system's data like a 85-year-old who fell and broke their hip 2 weeks ago, and your patient is hospitalized and you're trying to do rehab in order to allow the patient to go home or to go to a skilled nursing facility. Allow the large language models or the AI for the health system. If you have your own individual account, great. But even if that vendor says they can handle patient data, students don't get to decide where patient data goes. The health system does.
Got it.
And one of my concerns is in the next few years, students or clinicians will get in trouble or will have a HIPAA violation for breaching patient confidentiality by sharing the data with a personalized AI agent or a large language model. UIC's AI is not going to be covered by another health system's rules and regulations and lawyers.
As a student, if I want to use AI to help me with a complicated case, even if I put in non-specific information, like you said, an 85-year-old female with this condition, could I still get in trouble for that?
Depending on the exact specification, 85-year-old with a specific condition, you'd be surprised on how few pieces of information you can identify individuals, especially with dates or years. Trying to understand all the data elements of personal health information is hard, but also for complicated cases, we have better tools. We have textbooks, we have the library, we have search strategies and knowledge sources that the faculty have shown you over the last couple of years. Please use those. The example I will give you as a warning, researchers a year ago came up with a fake disease, posted it online as a fake journal article, and all the large language models are diagnosing patients with the fake disease. If you read the fake journal article, the faculty member was at the Starfleet Academy. It was funded by SpongeBob SquarePants. So as a student, as faculty, as clinicians, you would know it was fake, but unfortunately the large language models are now diagnosing individuals with this disease, and general AI is not trained on the clinical terms, and as we have found out, more and more people will be trying to deviate or cause potential harm, maybe humorous harm, using these AI models.
Yeah, let's say I'm using AI. Who even decides in the first place if an AI is private health information or HIPAA compliant?
Every hospital is going to determine whether or not an AI agent is HIPAA compliant from that health system's or clinic's point of view. So at UIC or UI Health, they will have potential AI large language models that are approved. If you go next door, they may have different AI. So you as a student don't get to decide, oh, well, this AI model is HIPAA compliant. The health system does.
I'm going to be in several different institutions, and they all use different healthcare systems. Why are all healthcare systems so different?
Well, as you rotate through different health systems, they choose different electronic health records. Some have Cerner, some have Epic, some have WebPT, we have over 300 different vendors, and each health system has a different computational backend that you use. And just like the clinics get to decide what tools they use to manage their patients, each clinic gets to decide what AI they feel is appropriate for their patients. Part of this is a risk assessment. Each clinic has to see what vendor will and will not sign off on the HIPAA compliance and will sign off at the level that they're comfortable with. Different vendors give different information. There are some vendors where you don't know where your data is going, and some health systems are comfortable with that, and some health systems are not. And so as we continue to emerge with AI, the legal requirements as well as the implementation requirements are going to change, and every health system has a different risk tolerance of using these tools or see this as a benefit. All of these tools cost money.
I use ChatGPT to help me with complicated cases and sometimes to help explain like a physiology concept or some condition. And but what would that look like in the clinic? Where will I encounter AI? How will I interface with it?
When you interface with AI in the clinic setting, there'll be a couple of different ways, and there will be millions of more ways that we will imagine in the future. One will be through the record-keeping system, the electronic health record, the electronic medical record. It may be part of it and will give you proposed text that you might have to edit. It might be part of a clinical decision support. For a clinic setting, if you're using AI, make sure you're using hospital or health system approved versions of Microsoft Word or Adobe or any sort of tool that you're using. Use the approved tools in order to work with that health system. AI is being added to almost every tool, and if you're using health system tools, the health system will approve. Taking your UIC tools or your personal tools, like your personal ChatGPT account, that opens you up to a risk of, did you share just enough information to make that patient identifiable?
So there's so many different chatbots and so many different factors. If I feel a little overwhelmed, who can I go to for guidance on this?
At each placement, you will have a clinical instructor or a key point person. And the reporting process or their level of concern or how they determine was it too much or too little information, they are the ones who will be your contact to the health system. This is complicated. The rules will change potentially even in the middle of your rotation as we better understand the tools. But your point person or the clinical instructor is the key person to say, hey, here's what's happening, here's where we are, as well as what are the approved tools for that time and place. Also, if you go back 6 months to the same rotation, it would be worth asking again because the tools have changed. Things are changing week to week, month to month, and that one key facilitator, instructor at that site will be up to date on what is and is not allowed. And if not, they know exactly who to go within the health system to find those answers.
Yeah, so of course, there's so much change and so much information surrounding AI. What's the most important takeaway from all this as a student who's going into clinical placement?
When directly interfacing with patients, use the clinic's tools. Don't use your personal accounts. Don't use your friends' accounts. Use the clinic's tools. If you're using the clinic's tools, you will be covered. And every clinic is different.
I know everything is centered around privacy, right? And so as a student, is there anything that I should be aware of for my own privacy?
Yes. In Illinois, we're a two-party consent, or if you're with a clinician and a patient and yourself, we're a three-party consent. If you are uncomfortable being recorded using a bridge or other technology, please talk with the clinical instructor at the individual site. Each site may not have policies. UIC will be building policies, but you don't need to be recorded if you have strong objections to. Having these conversations before you get into the exam room is probably better than just walking out of an exam room, but there are discreet ways of handling it. But as students, you have the right not to be recorded, and we will figure out how to engage and make sure your clinical experiences are helpful as well.
Thank you for your time, Dr. Boyd. This was really informative for me and very helpful.
Great. AI is going to transform healthcare. We just don't know how, and we're all figuring it out as we go through this process.
Thank you. Thank you for your time.
Thank you.